Hi, I'm DrIraNdvm. I've been a practicing veterinarian for 46 years. I graduated from the Ohio State University College of Veterinary Medicine with a Doctor of Veterinary Medicine and a master's degree in reproductive physiology. I had 3 practices in Woodbridge Township, which is northern New Jersey, and I moved out to Cape May County in 2012 to open a 24/7 practice in Claremont, New Jersey, which is just about exit 17 on the Parkway. The purpose of this project is to talk about practical veterinary medicine. What can you do? What won't cost a fortune? What can we do if it's not in our price range? And also, we don't want to just go ahead and run tests unnecessarily. We want to be able to know why we're doing it. The first thing we'll talk about today is picking a veterinarian. The main thing is, if you're going to pick a veterinarian, you have to be comfortable where you're taking them. Whether it's equine, small animal, exotic, small mammals, ruminants, you need to make sure that you have certain things. There's a new concept in veterinary medicine now for the last few years, and the practicing veterinarian needs to also provide emergency service after hours. And again, you want to be comfortable with the veterinarian. So the first thing I recommend is to pick a veterinarian. You can talk to your neighbors and friends. You can also go online. I really wouldn't put much stock in the online critiques. Very often, most people just write negatives online and you don't hear the good. So you have to kind of take them with a grain of salt. I always recommend that you call up the vet hospital that you're interested in. You ask for a tour of the hospital. There is no secret to the back room, and you should get a tour of the veterinary hospital you're thinking of taking your pet to. It should be clean. The people should be friendly. They should have a surgical suite by itself. And mainly you want to go ahead and make sure that it doesn't smell. If there's a boarding facility, check the boarding facility. Again, see how many times they go out during the day. What are the outside facilities? You'll know right away whether or not you'll be happy at that practice. The second thing is make sure that if they do not have an emergency service at that veterinary hospital, that there are emergency services available and that you can get to a veterinarian 24/7 if you have an emergency or even a question. At our 24/7 facility, we always had a doctor on call, a doctor there actually, and we had a full staff so we could do any kind of surgeries we needed to, and we would be able to answer questions if people called after hours. If you need a specialist, see if there are specialists in the area. Some hospitals that are specialty hospitals will also have general practice. They often are a little bit more expensive than going just to the local GP, but you will have the facility that has emergency room facilities and specialty practices at the same facility. So it's a trade-off as far as cost goes. The price of veterinary medicine has truly increased in the last few years, so it's always important to ask what the costs are, what the prices are, different things. The exam fees, the vaccines. There is no reason in the world you can't shop for services, but make sure that it's apples to apples, not apples and oranges, because a lot of times they will give you the price of a spay, for example, but they won't tell you that it doesn't include pain management, pre-anesthetic blood testing, and other things. So you want to make sure that you go ahead and you have a pricing, but make sure it's within your price range. The other question to ask when you're looking for a veterinary hospital, if your pet has to be hospitalized overnight, is there staff there overnight? And is the staff a certified technician? Do they have access to a veterinarian? If there is a problem during the evening, overnight services should be provided so that there is at least access to a veterinarian, that there is a veterinarian on call. If you do those things, I think you'll be very happy with the practice that you choose. As far as insurances go, when you get your pet, there are some very good insurance policies. Some include vaccines, some don't. But if you have an animal that is prone to cancer, such as boxers or Goldens, if you have a large dog which might have a gastric torsion, which can cost upwards of $5,000 to $10,000, it might not be a bad idea to look into some of these insurance policies. When I was practicing, Trupanion was the insurance company that seemed to be the best to deal with, but there are many insurance companies that you can look at and see what they provide for you. You can also self-insure yourself by taking $200 every month, put it into a veterinary fund so that if you should need it, it'll be available to you. And the last thing is that you should also have a list of questions when you go in to see your veterinarian. When I was practicing, I always enjoyed or appreciated people bringing lists of their questions in so they didn't have to think about it, and we could go right through their questions and answer them right on the spot, just going by using a list. If the veterinarian gets a little bit aggravated because you bring a list of questions in, then I would find somebody who's more amenable to answering all your questions and taking the time to explain things to you. I used to tell people I will explain it 10 different ways, but if you don't understand something, you need to tell me so that I can explain it to you so that you are fully understanding of what the problem is, what the disease is, what the surgery is, what the post-op is. You need to be totally informed of your pet's care. And lastly, make sure that if you wanted a referral, that they are amenable to sending you for a referral. Say your dog needs surgery and you would like a second opinion, I would go see somebody who is qualified to give the second opinion, whether or not it's a board-certified surgeon, a specialist somewhere. But if you're not comfortable with the diagnosis, get a second opinion. But don't go to another GP down the block. Go to somebody that is qualified to give that opinion. And if your veterinarian gets upset you want a second opinion, then again, that's not the veterinarian for you. I would tell people get 5 opinions until you're happy and you hear somebody that you really trust. And I have no problem them coming back to me after getting another opinion. Actually, if they want a second opinion, no matter what I say, they're not going to totally trust my opinion, and they're not going to be happy, especially if the outcomes don't go the way they would like it to. So always encourage second opinions, third, fourth, and fifth opinions, and just ask that you be kept in the loop, and that after the opinions are given, you can get a copy of the records so that you're totally in the loop of what's going on. So that's a little bit of what we will talk about in the future. We'll do some disease processes and some different medical processes. We'll take one at a time and we'll talk about them so that it's in layman's term and that you can totally understand what will be happening with your pet if it's a diagnosis that is made. We can also talk about a few other things. We'll be talking about horses. We'll be talking about small ruminants. I'll have some specialists in that will help with kidney disease, diet. So I hope that this is informative and that I've helped you in some way.